Are we really seeing a spike in cases, John? And how concerned should we be?
Yeah, good afternoon. We are definitely seeing a spike in cases, but when you compare it to what's happened, especially over the last 3 years and even a year ago, the concern isn't nearly there at that point. Essentially, they're describing it as kind of like a ski jump where the cases have gone up and they've started to come down over the last 4 to 6 months. And at the end, there's just a little bit of an upswing, 12%, like you mentioned. To put numbers in perspective, July 22nd, that week, 8,000 cases or hospitalizations in that week. A year ago, 44,000. So you can see a big difference there. However, we do know now that the variant that is out there, the dominant variant, is the XBB variant. 95% of the virus is, and unfortunately, only 17% of people have that XBB or have the current booster, the bivalent booster shot, that can protect them as much as possible.
How virulent or infectious is this new variant? And you will get to the vaccination question in just a minute.
So the virus itself is very contagious. It's very easy to catch, and it's essentially getting to the point where you can catch it just about anywhere you go if the cases are there. As far as virulence, how bad it is, it doesn't seem to be nearly as bad as it was, even over the last few months or so. And this XBB one, more contagious, less virulent, but it is certainly out there, especially for people who are more vulnerable, those above the ages of 60 or 65, those with pre-existing medical conditions, especially if they're immunosuppressed. It can still be deadly for them. Luckily, deaths have not gone up, but they do delay by a couple weeks, so we're going to definitely keep an eye on that.
You said that only about 17% of individuals, I think is what you said, have the XBB protection in the vaccines that they have taken. Is there a new booster that is going to come out that will protect or supposedly protect you against this disease, this strain of the disease, I should say, number one? That's number one. And number two, if I have had COVID and I have had 4 shots, as I have, do I have some protection beyond what an unvaccinated person who has never had COVID has?
And I'll go ahead and answer that last part first, and that's one of the reasons we're not seeing the virulence there, because people are vaccinated, maybe have not gotten the booster, and that's what I was referring to. 17% have gotten the booster. It's not an XBB yet. I misspoke on that one. It's just the old type of booster that's there, but 17% have gotten that booster. The rest of us have either gotten the boosters, gotten the shots, gotten infected, or all the above, and so we do have some protection. The concern is what's going to happen in the fall as that protection starts to wane and that XBB variant comes on. Well, the FDA just went ahead and they made recommendations to put the XBB 1.5, which is one of the dominant ones, in the new booster that's going to come out in the fall. They think by August, Pfizer will be able to submit for its FDA approval, and then the CDC will move forward with what they want to do as far as recommendations and who should be getting it.